Hello, good morning, everyone. This is Jasimul Haq. I will be starting the session and would like to invite Dr. Kanak Lata to please introduce and start as opening ceremony so we can proceed further.
Hello, dear all.
Hello, yes, you are.
Yes, you are audible to everyone.
I hope I am audible to all.
Yes.
Yes, you can proceed further.
Thank you so much, Mr. Haq, for providing me such a wonderful task to welcome such a great people today on the common platform of awareness session. A very warm greetings from Metro College of Health Sciences and Research to all. Myself, Dr. Kanak Lata, Director Education of Metro College of Health Sciences and Research. It's my great pleasure to welcome all the eminent speakers to this program, Masterclass on COVID-19 Infection and Prevention Guidelines, which is jointly organized by the Metro College of Health Sciences and Research and Kindshell Global, Canada. We welcome all the eminent speakers and participants to this platform. Ms. Bobby Martin, founder of Global Nurse Network, USA. Ms. Shaladi Gupta, founder of Kindshell Global, Canada. Ms. Rebecca Silov, President, Society of Nurse Scientists, Innovator, Entrepreneurs and Leader, USA. And our Managing Director and Director of Metro Group of Hospitals, Dr. Sonia Lal Gupta, who is also a practitioner neurologist and a visiting faculty of New York Medical College, USA. And all young and enthusiastic participants, all faculty, students and alumni from different colleges to this online certification program, Masterclass on the topic COVID-19 Infection and Prevention Guidelines. I would take this opportunity to briefly introduce the Metro College of Health Sciences and Research, which is a part of student-centric services of reputed Metro Group of Hospitals, founded in 1997 by Dr. Purushottam Lal, a Padma Bhushan and Dr. B.C. Roy National Awardee, who is a pioneer of interventional cardiology in India. Metro Group of Hospitals are committed for providing best healthcare facilities at various locations like Delhi, Noida, Meerut, Haryana, Haridwar, Gurgaon, Gujarat and Rajasthan. Metro College of Health Sciences and Research offers nursing, paramedical and pharmacy courses. The nursing and paramedical courses started more than a decade ago, offers MSc Nursing, BSc Nursing, GNM and ANM courses. And in paramedics, cardio, OT, CT, dialysis and optometry technician. With the approval from all different governing bodies like Indian Nursing Council, Delhi, Uttar Pradesh Medical Faculty, Lucknow and CCS University, Meerut. And the bachelor and diploma courses of pharmacy is offered with the approval and affiliation of All India Council for Technical Education, Delhi, Pharmacy Council of India, Delhi, Dr. Abdul Kalam Technical University, Lucknow, and Board of Technical Education, Uttar Pradesh. The college understands and values the importance of quality education in shaping the future of not only our students, rather nation, and therefore is determined to create an environment where the academic excellence flourishes under the able guidance of our patron, Dr. Purushottam Lal, and a very dynamic and young achiever, our Managing Director, Dr. Sonia Lal Gupta, and has won awards and accolades. Like the Metro College of Nursing has been awarded the Best Nursing College Award at Indian Healthcare Excellence Award 2019 by the Minister of State, Health and Family Welfare, Government of India. Dear all, we all know that the world is currently facing unprecedented challenges. As early as 4 months ago, nobody knew that with such advancement in medical sciences and technology, there can be a situation where a novel virus can virtually push the whole world to a standstill and affect the number of countries even unthinkable in a world war. The current COVID-19 has affected nearly 200 countries and more than 13 million people with nearly 4% fatality rate. The nature of disease is such that even the dear ones refrain from approaching the patient, where doctors and healthcare workers attending the patients like angel to the mankind. I'm happy to share that many of our college alumni are also playing the role of Corona warriors, serving in many parts of India and abroad. In this scenario, it is very apt to listen to the experts who have deeper knowledge in different aspects of the COVID-19 infection and prevention guidelines. I would like to mention that our Managing Director, Dr. Sonia Lal Gupta, has been very active in spreading the awareness about the disease and has been much sought after experts of many national media channels for getting her medical advices for prevention and management of COVID-19. Once again, I welcome all the eminent speakers and enthusiastic audiences to this program. Thank you all. Now I would like to call Mr. Jasimul Haq again.
Wonderful, Dr. Kanaklata. Thank you. Thank you to the Director of Education for such a detailed introduction and welcome session. I will now proceed further to start masterclass session on COVID-19 infection and prevention guidelines. Starting now, I would like to invite one of our prominent personality, highly qualified American board certified neurologist, specializing in headache medicine and vascular neurology. She has been leading Metro College of Health Sciences and Research as managing director and as well as director of Metro Group of Hospitals. She is a visiting professor at New York Medical College, USA, and has formerly been assistant professor at Loyola University, Chicago. She has been awarded the Neurologist of the Year award at the Indian Health and Wellness Summit in 2014 and Times Healthcare Award for Young Achievers in 2017. We are honored to have her on board as a speaker. Please, all of you, welcome with me. Welcome Dr. Sonia Lal Gupta as a speaker for the next session.
Thank you so much, Mr. Haq and Dr. Kanak. It's kind of embarrassing when your own team presents you in such a high way, but thank you so much. And first, I'd like to absolutely thank Kindshell Global, Shiladi, Rebecca, and Bobby for taking out time. I know it's super late over there. It must be like 12:30 right now. At night, not in the afternoon, guys. At night, so they're awake. They're staying awake just for us for this special masterclass. So I really appreciate that you could coordinate the time that worked out for India. Really, thank you so much. And I'm so glad we are doing this. This is such an important topic, and we know how COVID-19 has just overtaken the world, and it has changed, I think, the dynamics completely, of the entire country, not only countries, in fact, I think the world, and we all are seeing that. So again, I'm very excited and happy that we are, doing this online certification program, and hope that everybody learns something, from this today, and when they take the message home. So I'd like to share my screen. Let me see if I can share it. Yeah, so I'll basically be giving more of an introduction of, what the COVID-19 virus is, and more so about the transmission and what symptoms you can see. And of course, our esteemed speakers, they're going to further take along, and they'll explain to you what prevention guidelines, you have to keep in mind when you're taking care of patients, or when you're taking care of family members, or anybody, with the COVID-19 infection. And it's not a very scientific presentation. I've tried to keep it a little bit more simple, just for everyone. And if you have any questions, of course, in the end, after all the talks are done, we'll be happy to take questions from everyone. So let us start, with the first slide. So what exactly is the COVID-19 pandemic? Well, this is an ongoing pandemic that is caused by the SARS-CoV-2 virus. So this particular virus actually falls in the category of coronavirus. And coronavirus is also the same category of viruses that actually causes common cold. It is just a different mutation and a different type of coronavirus. So this particular virus is basically a severe acute respiratory syndrome coronavirus. And we've had other, epidemics in the past, like the SARS epidemic we had in 2001, or the MERS epidemic we had, a few years later after that. And this particular pandemic, was first actually discovered in Wuhan in China. And we all know how much India loves China now. I think we don't love China at all. But it was discovered in Wuhan in China in December of 2019. And now at this point, it has spread globally with currently, this data is from, as far as yesterday that I know, 14.3 million cases worldwide. So just to give an idea where Wuhan is in China. So this small town in China, it started from their seafood meat market over there, and initially a first few people got infected, and then people started realizing that the infection rate, the transmission rate is way more higher than the other viruses that we typically see. And that is when it started raising bells that this is not something normal. And when they saw the symptoms of this particular virus, it really got concerning to how sick some people can get. So it started from here, one small town, and now it's all over the world. US is leading in such a bad way right now that it's quite sad to see the number of cases that are increasing over there. Brazil is second, and unfortunately India is now number 3. With our sheer population and density, it gets very difficult to control the numbers. And yes, we are very high, but I think everybody is trying their best. The governments are trying to do whatever they can for the current situations that we are in, because for the current situations we have, for the current facilities we have. But you can see over here, that it started in China, and then after that Italy had a very major outbreak, Europe had a very major outbreak, then USA started, New York was completely reeling under pressure, and after that Florida and Arizona and Texas are right now leading. Fortunately, I think in Canada it's been comparatively it's been under control, which is great, and Brazil, as we all know, and of course India. So what are the latest number of cases we're having currently? So this is the latest data from yesterday. So worldwide we have 14.4 million cases. We have more than 500,000 deaths, or 5 lakh deaths. And yes, 86 lakhs or 8.6 million people have recovered. India right now is moving forward with more than 1 lakh cases, and long ways to go, I think, before things start getting better. Yes, yesterday we had 40,000 cases within a single day. So yeah, so I think we've still not reached our peak, and that is what is frightening at the same time. So let's come to the transmission of COVID-19 virus. And I thought this particular slide, from the World Heart Federation really explained in a very detailed and nice way about what this virus does. So, you must be seeing it all over the news. You must be reading about it everywhere. Droplet infection. What exactly is droplet infection? So, droplet infection is when we talk loudly, when we sneeze, when we cough, and even when we talk normally within a short distance of up to 3 feet. These viruses are basically found in our mouth, nose, in our respiratory system. So when we talk, the virus comes out once in the form in our saliva. So it's basically found in our saliva. And when it comes out, it settles down in some time. So when it settles down, so as you can see in this particular area, droplets containing the virus in the air, and they start falling into the surfaces and objects. So let's say it fell on somebody's phone, or it fell on a desk. Now, when you touch that particular desk, and when you touch your eyes, nose, or mouth with that, the infection can enter your system, and the virus can enter your system and cause an infection. The other way it can happen is, let's say you're not maintaining that social distancing. Why is social or physical distancing important? Why are we stressing on that all the time? That is because if within that 3 feet, the droplets may not even settle down. They might remain suspended for a little while, and you might end up inhaling it, as we can see it over here. It might land up on your nose, mouth, and possibly, and then it can enter your lungs, and that's how the infection spreads. So this is the droplet mode of infection. Now, recently the WHO came out that possibly the COVID-19 virus is, airborne. So what does that mean? So that basically, if we see this particular diagram, you can kind of make out what I'm trying to say over here. So the person sneezes. These are the, saliva molecules or the droplets that basically contain the virus and cause the droplet infection. So the size is more than 5 microns. Now, to give you an example of how you can think, your human hair, one single hair, so literally one single hair, typically ranges from 60 to 120 microns wide. So just imagine, you can now imagine this is only more than 5 microns, so how small the droplet is. But in airborne transmission, these droplets are even smaller. So because they are so small, they remain suspended in the air. And what our data so far has shown, what has been published in the Lancet journal, we know that these airborne droplets, these airborne particles can remain suspended in the air for up to 3 hours. So this definitely becomes concerning, because if you're not wearing a mask, you can breathe in this particular, you can breathe in these particles, you can inhale these particles, they go into your lungs and it can cause an infection. So that is why the stress on 2 reasons. I mean, when you just understand the transmission, you can understand that why is it important to keep a distance, of ideally 6 feet, but at least minimum of 3 feet. And why is it important to wear a mask? Because if you're not wearing a mask, you're literally exposing yourself. You're not only exposing the other person, but you're exposing yourself. And the moment you expose yourself in COVID-19 infection, it's not just about you. It is about your family. It is about your community. This is one infection where you getting sick means many people getting sick. So you're not only responsible for your own life, but you're responsible for other people's life as well. So this, another, image printed in the Lancet journal kind of gave us an idea for how long, do these particles stay. And I think this is important, especially from a nursing standpoint also, because, it gives you an idea that, okay, what are the objects you have at home in case especially when you're coming back, after taking care of patients and you're coming back home. That's why it is important to change your clothes right away, take a bath right away, wear your clean clothes and only then come out and interact with your family. Because as you can see, in papers, you can see it can stay for up to 3 hours, on wood for up to 2 days, on glasses up to 4 days. That's the reason. That is the reason that, it is recommended if somebody has the infection, do not share your utensils. Do not share your utensils with anybody else, because the virus can stay for so long. Up on clothes for up to 2 days, on banknotes. So the money that we use, it can stay up to sometimes 4 days. This can vary, and what are the chances, that yes, you will touch that note, it has the virus and you might get it, but that is why it's important to keep washing your hands. What is the whole purpose of this slide is to tell you that how important it is to continuously wash your hands, clean your hands, either with soap or water for at least 20 seconds, or by using a sanitizer which is alcohol based. But this is the reason, because the virus can stay on all these objects for so long. Another interesting point I wanted to kind of raise over here is that when this virus initially came out, now all of you have to understand this is a very, very new virus. This is a very new virus. It has just come out, in the past 6 months. So every day we are learning something new about it. Every day we're understanding. That is why so many times you'll see new articles, you'll see new, news items popping up that maybe this is coming up or this is coming up, but every day we're learning. So initially there was hope that as with the other viruses like the flu virus or the influenza virus, when the heat wave comes or when the temperature goes up, the virus will, get destroyed. Unfortunately, it does not. Unfortunately, it does not. It typically gets more destroyed when the temperatures go up to 70 degrees. And as you know, that is something we don't even want to, think about. So just something to keep in mind about how long the virus can stay on different objects. This particular slide again, really fascinated me. It just gives you an idea about how the transmission rate, like how contagious this particular virus is. And in comparison, as you know, measles is a highly contagious virus. As we all know, this particular, that is why at 9 months, all the children, they're supposed to get the vaccination, because one case of measles can infect up to 12 to 18 people. Just imagine. That's why it's very important. Fortunately, we have a vaccine for it, and that is why we are able to control it. Same thing for polio. India has fortunately been able to completely eradicate polio, and the reason and why was it worrisome? That because one case of polio can infect 5 to 7 people. Similarly, when we come down to COVID-19, this can infect up to approximately each person can infect up to 2 to 3 people, and that quickly adds up. And that is with the minimum range of people, that if you're not keeping that distance. So something to just basically keep in mind when we see the COVID-19. I think we have a pen pointer. Do I have a pointer over here? I do. Okay, I can use the pointer. Good. So yeah, so basically we can see in the COVID-19 how it can easily infect 2.5 people, but see, that multiplies, and that is what you have to keep in mind. If one person is infecting 3, let's say, then 3 are infecting 9, and that's how it just continues to increase, and we don't realize how quickly this can spread. I think I need to okay now. So now let's come to the symptoms of the COVID-19 infection. So one thing we all have to understand, the incubation period is from 2 to 14 days. So what is the incubation period? The incubation period is from the time you get exposed to the virus. So let's say I am a person and I got, I recently actually had the COVID-19 infection, so I can tell from personal experience that when as a person you get exposed to somebody who has the virus, from the moment you get exposed to the time you get the infection is called the incubation period. And this can range anywhere from 2 days to 14 days. But on an average, 5 to 7 days is what we see. Typically 5 days is that average amount. So after you get exposed to someone, when is the most worrisome period that you might have symptoms? It can go up to 14 days, but it is typically 5 days in majority of the cases. Now, what are the symptoms we see? COVID-19 infection, it's a conundrum. It's like this confusing thing because everybody has different symptoms. And the fact is that a big chunk of people, actually up to 80% of people, have mild infections. And some people are just asymptomatic. By asymptomatic, we mean they don't even have infections. So what are the common symptoms? Fever or chills, a dry kind of cough. Difficulty breathing is actually one of the most concerning symptoms, and a fairly common symptom, and a symptom that we can see, not fairly common, but a symptom that raises concerns that a person will need hospitalization. Fatigue, feeling tired, body aches, headache, loss of taste or smell. This is a very good clue. If somebody suddenly has a loss of taste or smell, that they have not had before. So how will they get to know that? They will not be able to smell anything, and they'll find it difficult to actually taste their food. They won't be able to make out, what they're eating. So that symptom points out that possibly you can have a COVID-19 infection, and it also basically somewhere what the relation has been seen that it could be a milder infection, thankfully. Apart from that, other symptoms that you can see: sore throat, nausea, diarrhea, but the most common symptoms are fever. And when is it concerning? When do you consider that, okay, somebody might need to go to the hospital? When they have continuous fever of more than 100.4 continuously, typically 101, 102 for at least 5, continuously for 3 to 4 days, go to the hospital. Difficulty breathing, go to the hospital. Oxygen saturation less than 94%, go to the hospital. Anybody who is above 60, anybody's parents who are above 60, or anybody who has other comorbid conditions like high blood pressure, diabetes, asthma, any of those conditions, cancer, do not wait. If you get a fever during the pandemic, go to the hospital, get tested. You rather be admitted than to wait till you're worse and then go. So it all depends on who you are, what conditions you have, what are your symptoms. A lot of milder cases, like fortunately in our case, our infection was mild. We just had fever for 2-3 days, and along with body ache. So we were able to home quarantine in that situation. So it all depends on what symptoms the person has. How do I move forward? Okay. Now, this particular slide, I'm just, I wanted everybody to understand, why are we scared? Why are we doing this talk? Why are we talking about prevention? Why are we stressing on this? Because if we start looking at what the disease course is, as we can see over here, so an average incubation period is 5 days, as I explained, from the time you get exposed to the virus to the time you start having symptoms. Typically after that, in most of the people you see, in almost I think 80% of the people, you see this acute mild phase, which is typically from 5 to 10 days, where you start having this low grade fever, body aches, you might have a cough, but overall you're feeling okay. Most of the people go through this acute mild phase. Now after the 10th day, after the 10th day, in some people, now this is 20%, this is the 20%, they might start having more symptoms. And that is because in this particular virus, we can get something called a cytokine storm. Now, what does that mean? Cytokines are basically inflammatory markers. So when people talk about inflammation, so this particular virus is not only an infection, it is also a virus that causes inflammation in the body, and at very high levels. It starts making your blood thicker at very high levels. Now this does not happen to everyone, so nothing to get panicked about, but just something to keep in mind that it can happen in 20% of the people, especially those people who are obese, who have uncontrolled diabetes, and who are in that age group of 60 to 70 or above. It's more common than that, but that being said, young people can also have these symptoms, although it's not very common. What happens in this lungs start having very major changes. People are having great difficulty breathing, they need sometimes oxygen, they need sometimes to be on the ventilator. You start seeing increase in the levels of different inflammation markers, and that can include levels like CRP, IL-6. If you guys have read about it, IL-6 is a particular marker that D-dimer test is done to see how thick, how much you're prone to any embolus, if you need to be on blood thinners or not. But again, this happens in only 20% of the people, and out of that also, a majority of the people recover. So what we can see over here, majority of the people recover, but the highlight over here is the oxygen saturation actually goes down. So hypoxemia basically means low oxygen, and typically if it falls less than 94%, you should be in the hospital. So just again an advice for everyone, in case somebody has fever, I'm not sure who's making lines over here, but anyhow, if anybody has symptoms, of fever, do keep a pulse oximeter with you. It's very easily available everywhere in the market. Keep that pulse oximeter with you and keep on checking your oxygen levels at least twice to thrice a day. It should always stay above 94%. If it goes below 94% or you have difficulty breathing, rush to the hospital. Okay, so this just quickly about my last slide. This particular slide is again to kind of give you an idea about how many people get mild, like what is the time frame from where the point where you get infection and what is your recovery, So in majority of the people, more than 80%, it's typically mild. So in 2 weeks, you start feeling absolutely better. You become non-infective. So if somebody has symptoms in mild or moderate cases, typically you become non-infective in 10 to 14 days is the onset of the infection. So it's 10 to 14 days from the onset of infection, where you become, where you cannot now infect other people. The one thing you have to know about the COVID-19 infection is that it can infect other people in the sense even before you have the symptoms. That is why wearing a mask at all times, washing your hands at all times is extremely important. If somebody has severe infection, it can take up to 3 to 6 weeks, and if somebody is very sick, up to 2 to 8 weeks. And that is why it is very important to understand the prevention of the COVID-19 infection, not only for the healthcare workers but for everybody around you. And healthcare workers especially have to take extra care. Now you can understand why we are doing this, because for a normal person who's not dealing with sick people all the time, for healthcare workers like our nurses, our doctors, our technicians, everybody who's there in the front line, they are getting exposed to this virus continuously from sick patients. And that is why it is important to understand, why do we stress upon properly wearing your PPEs? Why do we stress upon using the preventive and infection, preventive measures? And I'm looking forward to hearing rest of our talks regarding that. So I just want to thank everyone once again, and of course thank all our healthcare workers who are here today. Thank you so much for being there, being in the front line. You have no idea what you're doing, and you have no idea what a wonderful thing you have done. The day you decide, yes, I'm going into nursing, yes, I'm becoming a nurse, or I'm becoming a healthcare professional, I'm becoming a technician, I'm becoming a doctor, whatever you decide, that is the day you actually make a goal, you make a move to say, I'm going to care for people. And right there, people say good deeds. Everybody wants to do something good in their lives. I think the moment you become a healthcare worker, God gives you that opportunity to be that good human being and to do good for others. So thank you so much, everyone. And I'll just stop sharing my screen.
Thank you, ma'am. Thank you, ma'am. Thank you very much for the detailed awareness.
Can you just
of
stop
COVID-19.
sharing my screen, please? Yeah.
Yeah. So we got to know about all the details of COVID-19, from where it started, where all it spread, what are the latest numbers, charts and transmissions, how it comes through saliva and spreads to other parts of the body. Also, what are the importance of social distancing, why it is important of wearing masks, why it is important to wash hands regularly. Everything we get to know. Thank you very much. And it was very interesting to know the comment, the details on WHO's recent comment on airborne transmission. This will all increase awareness of all of us. Thank you again, ma'am. Thank you for such a detailed briefing and motivational quotes. Now, I would like to further proceed and welcome highly experienced nurse expert and nursing entrepreneur who has served as a director of nursing, assistant chief nursing officer, and dean of nursing. She became an expert in transition to practice among new graduate nurses and transitioning nurses at all levels of their careers. Her expertise led to the creation of global nurse network and for the innovative strategies that connect expert nurses with practicing nurses in real time through open source technological solution. Global Nurse Network is a dedicated cadre to professional nurses that elevate practicing nurses' competence, and help them improve patient outcomes. I am pleased to welcome and invite Ms. Bobby Martin for the session. Thank you very much.
Thank you very much for that introduction, Mr. Heck. I appreciate that very much. And thank you, Dr. Kanak Latha and Dr. Sonia Gupta for what was a wonderful and brilliant introduction to this session. How beautifully concise that was in helping everyone understand why we are truly afraid of this. But I will be providing how nurses can really lead routine infection prevention and control as we move forward. But right before we do that, we're going to take a look at just how easy it is to transmit this virus. Shalati, could you go ahead and share and make sure the volume is shared? Thanks.
Looks like the doctor.
What's that on his tie?
Oh my gosh, it's MRSA.
Oh no, he just transferred the MRSA to the counter. All over the
Now
counter.
just think of that as COVID, everyone.
Did he just touch his tie?
I think he did.
He did.
Oh, he touched his tie, and then he put his hand on her arm.
Look at his tie is on the IV site and her arm. Oh no, and now it's on the side rail.
Yes.
He didn't wash his hands.
I don't think he did.
Oh, now it's on the door.
He's contaminated the door.
Other patients, here we come. Okay, who's next? This looks like a tech, maybe. What is that? C. diff?
Oh my gosh, there's C. diff on the blood pressure cuff.
Oh no, it's on the patient's arm.
And the stethoscope.
And she didn't wash her hands either.
No, she didn't. Oh, she just transferred it to the bedside commode. And instead of wiping down the blood pressure cuff, she just put it in its container.
All right. Thank you, Shalati, for sharing that video. I wanted to share that with the group that is on the call, just so you can have a visual of what that looks like and how easy it is to transfer this infection on what we call fomites. Just like Dr. Gupta shared with us, this virus can stay on our clothes for 2 days. It can stay on glasses for 4 days. So just taking a look at that video shows you how easily it can be transmitted across the room, across patients, between healthcare workers to our patients, to visitors in the rooms. So what we're going to talk about, specifically what I'm going to talk about, is how to protect yourself and others with the summary of changes that have been recommended by the CDC as July 15th. So go ahead, Shalati, you can share, hit the slide. Oh, there we go. Now, nurses are really an integral part of leading the infection control and prevention across your nation, across my nation, across the globe. And one of the things that will be important to do as we move forward is to collaborate with our healthcare leaders and collaborate with hospital administrators. One of the biggest things that we can do, that Dr. Gupta shared with us too, is to monitor ourselves and be aware if we are exhibiting signs and symptoms. But what we can do as nurses as well in the hospital setting is to implement triage and nurse-directed triage protocols. And what that means is set up a system where patients have the opportunity to ask questions if they should come. Dr. Gupta said very clearly, if we have a pulse ox lower than 94%, we should go to the hospital. If we're having difficulty breathing, we should go to the hospital. It's ideal if patients have the opportunity to access nurses through telehealth and get this nurse-directed triage based on protocols that is recommended by the CDC. Another recommendation how nurses can lead this routine infection prevention is to screen and triage everyone that comes into any healthcare facility. Some of the signs you see here on the screen that the CDC puts out, and other organizations as well that are just as good, is to make sure people are aware if they have these signs and symptoms, to be sure that they notify someone so that we can take appropriate actions and isolate them, to cover their mouths when they cough. And it's our job to make sure that we're screening all those folks. Shalati, you can go ahead and click the button. Because I want to show you the CDC's recommendation for implementing universal PPE. I will go into a little bit more detail for you in PPE, but it's critical that you protect yourself with the right PPE, that you wear your gown if you're going to be in contact with someone with COVID-19, clean gloves, a respirator mask if you are with an active person with that infection, face shields, and goggles. And we'll go over how to put these on and take these off in the proper order, because that's really critical that you're aware of that as well. Other thing, you can click the slide again, Shalati, because we'll just talk about a little bit of processes that the nurses should really be involved in as well. And that's to be part of teams. Nurses are developing different types of teams to help during this crisis, including reevaluating patients who have been admitted, who were initially negative, but maybe have been developing signs and symptoms. But also, it's really important to identify a process for when and if our healthcare workers are exposed to COVID. Like Dr. Gupta shared with us, we're exposed every day in the healthcare setting. We're taking care of patients with COVID. We have to make sure that if we have had a breach in our PPE, if we have been exposed, that there's a process to protect our coworkers and our patients and our families when we have been exposed in the work setting. Shalati, you can hit the slide again. And as nurses, we can lead this effort to encourage in the public health arena in our communities, to encourage the physical distancing. That can be very difficult in a hospital. Some strategies you can use are to separate chairs in your waiting rooms to make sure that you can schedule appointments if that's possible. Encouraging physical distancing during meetings with physicians and nurses and patients' family, having space available to where this can be done safely. Limiting visitors. We've had a terrible experience in the United States not allowing patients to visit, especially in New York during the big crisis we had back in March and April, not allowing visitors to be with their families, which is very distressing. So encourage good use of space in your facilities to encourage proper physical distancing and ways to communicate between your patients. And then I will talk briefly about this routine infection prevention that is getting a lot of buzz in the United States as far as cloth face masks. It's important to implement universal source control measures. And what we mean by that terminology, source control measures, is wear a mask. If you have a surgical mask, wear a surgical mask. If you have a cloth mask and you are going to places of business and you're running errands or doing your shopping, any of those things, you should be using source control measures, which are these cloth barriers. They will keep your secretions within your airspace, and then also encourage this social distancing as well. The same thing in the hospital. You should be wearing the proper PPE when caring for your patients, but in areas where you're not caring for patients, break rooms, changing rooms, locker rooms, any cafeterias where food is served, any of those places, it's important to remove those masks you've been taking care of your patients with. Remove those safely and wash your hands in between every time you touch a patient. You greet a patient, you wash your hands before you touch them, before you apply your PPE, before you do any procedures, after you do your procedures, after you remove your gloves, and then again when you leave the room. You can go ahead and hit the slide there. Some of the recommendations now I'll shift to are for actually caring for your patients. Reporting is critical. You must report according to your hospital regulations to the health departments. Anyone who has been confirmed with the COVID infection. Patient placement, again, this is critically important. Dr. Gupta talked about airborne and droplet precautions. Make sure that you're following those guidelines. If your patients are on ventilators, that's something at the bottom of the screen called aerosol generating procedures. We are suggesting, the CDC is suggesting that patients who do have that kind of aerosol generating procedure be placed in the higher level if you have negative airflow rooms to do such things. Environmental infection control is also another thing. These are some of the aerosol generating procedures you need to be aware of where you may want to elevate your precautions to that airborne versus your droplet. And that's open suctioning of the airways, sputum induction, CPR, endotracheal intubation, and BiPAP and CPAP as well, bronchoscopy or any manual ventilation. Other ones the CDC has not committed to are listed here for you, and your organization will be making those decisions. But just be sure that any aerosol generating procedures are leveled up higher in protection. You can go ahead, Shalati. Now, what I would like to share, again, it's very important you do this in the right order. So I'm going to have Shalati click through these in the proper order. You're always going to put your gown on first before you will do anything else. You obviously will do your hand hygiene, number one, gown on first. Number two is, go ahead, you can click, is your N95 or higher respirator mask. It is important to know that your N95 mask is the mask that will protect you and your patient. It will, will protect you from this disease. If you have it, however, that N95 does expel that. You need to be very conscientious if you have been exposed to take yourself out of the healthcare delivery scene and protect yourself. Third, you put your face shield and goggles. This is critical. You have to have face shields and goggles. Absolutely a must. The bigger the face shield, the better as well. And face and goggles should be not have any spaces in between here so that you don't get your splashes under your glasses. And then last, you will put on your gloves. So first gown, then your mask, face shields, and then your gloves go on last. Often you'll put your gloves over the bottom of your gown. Taking them off, it is not that simple. You will take your gloves off first. That's easy, first thing. The second thing will be your gown, followed by your face shield or your goggles, and then your mask is taken off last. Your organization will let you know if you are to reuse those during care. It's highly recommended by the CDC that you do not touch that mask, because just think about it. If you keep touching that mask and you're going to remove it and replace it, what are you doing? You are putting yourself at risk to infect yourself. So be certain that you use these to protect yourself and your patient, and you can't wash your hands enough in between putting on and taking off all of your PPE. So I will close out. I know we're almost out of time. Click to the next slide. I just want to say lastly that our front healthcare professionals and employers are really responsible to go ahead and help us through this and give us the guidelines that we need, but it's up to us nurses to develop and implement those policies to keep everyone safe.
I don't know.
Thank you very much, Ms. Bobby Martin. What a wonderful video we have seen in the starting, and then all the details, how you shows how nurses can lead from front, and how can nurses lead routine infection prevention and control, especially when they are dealing with infected or suspected patients. I really thank you for such an informative session, and thank you again from the Metro College of Health Sciences and Research. Now I will further proceed and would like to invite another nursing expert who is internationally educated nurse born in Chandigarh, India, and currently serving as an educator in her own organization called Kindshell Global. She is amplifying success for global registered nurses. She was raised in an environment to support community and slowly and steadily learning clinical skills and holistic care. Kindness was nurtured in her family, and this inspiration spreads like an infection. She earned her BSc nursing degree, and after practicing as a registered nurse, she wanted to learn more about her healthcare internationally, and then she shifted to Canada for augment her nursing skills and career. At present, she is educating nurse at Kindshell Global and is a member of SONSIL. SONSIL is a society of nurse scientists, creators, entrepreneurs, and leaders. I would like to welcome Ms. Shailadi Gupta for her session.
Thank you, Mr. Huck, for such a great introduction, and thank you, Dr. Sonia, for having Kindshell Global and our team in spreading the information that we really need in India to prevent and prevent the spread of infection. And I'll start with thanking Professor Kanaklata as well for such a great introduction and welcoming us. And Bobby, it was an amazing toolkit for everyone to learn today for the PPE. And Dr. Sonia has given us the umbrella information of COVID-19, how it spreads and how it can be transmitted, and what are the different parameters that you have to keep in mind if you have COVID-19 infection. And I will be talking a lot about home care kit, how you can have all these different tools at home if you have COVID-19 or if one of your family members has it, and reporting it to the right authorities and going to the hospital if you have the infections. It is a time of crisis in healthcare, and we understand as a healthcare team at Metro Hospital and at Kindshell Global and everywhere that anyone can be stressed and may be concerned about being able to cope up with this present situation. It is pandemic, and we are in this digital era where we can at least talk to each other, but working within a quickly evolving environment can be challenging and distressing. So having the home care kit is a great way to start, and maintaining these supplies, for example, medical masks if available. If not, then as Bobby said, the cloth mask and eye protection and face shield or goggles for use by caregivers. And at home, if a lot of patients maybe are taking care of themselves at home. So if there are caregivers who are going in community, we call them community nurses. If they're going there, it's better that if you can educate those families of those patients to dispose of the paper towels in a plastic lined garbage bins, and tissues, waste container with plastic liner is the best way to not transmit it. And thermometer is also important to have it at home. And over-the-counter medications to reduce fever like ibuprofen or Tylenol or paracetamol at home if the doctor has prescribed it. And running water is important as well, to have running water and taps working in home so that a proper hand washing is done every 2 to 3 hours as a routine. And regular laundry soap, regular household cleaning products should be available, and make sure they are certified and tested. And alcohol prep wipes or appropriate cleaning products or high-touch electronics. So if you're using laptops, if you're using phones, it's better to clean them on a regular basis. And keeping your environment clean, as Florence Nightingale once said, having the environment clean, it saves a lot of infection, it prevents a lot of infection. So placing used medical masks, I've seen people using a mask and using gloves and throwing it on the road. So if you're seeing someone doing that, you have you should stop them right there, because contaminated items should be placed in a lined container and secure the contents and dispose of them with the other household waste. And also for keeping the environment clean, best way is to wash with regular laundry soap and hot water the clothing and the masks and facial coverings. And clothing, linens, and non-medical cloth masks and facial coverings belonging to the ill person can be washed with other laundry. And at least once daily, clean and disinfect surfaces that people touch often, such as toilet seats, toilets, laundry containers, bedside tables, doorknobs, phones, and television remotes. And the last one is about, making sure the water is not contaminated. And if you're drinking water, if you're storing it in the bottles or water bottles in your refrigerator, it has to be clean. It has to be cleaned with a disinfectant. A diluted bleach solution can also be prepared to keep the environment clean. And monitor yourself for symptoms. Dr. Sonia has already talked a lot about what symptoms a patient can have. And quarantine, I will talk a little bit about self-isolation at home for 14 days from your last exposure. For example, you visited someone and you came to know that the patient or the person that you visited is tested positive for COVID-19. It's a great idea, it's a good idea, and it's a safe practice to stay at home so that you don't transfer it to someone else. And if you have met someone who has lived or had close physical contact, it's better to keep yourself quarantined, self-isolate yourself. And if you had direct contact with body fluids of a person who has COVID-19 without the recommended PPE, that's another point where you need to self-isolate yourself. And that's all from my side. I'll hand it over to Rebecca now.
Thank you, Shalati.
Thank you very much, Ms. Shalati Gupta, for such a detailed awareness, home care details, and about the details of kids monitoring system for the symptoms. Everything was very Wonderful. Thank you very much for coming with us and detailing us on the COVID-19 infection and control program. Now, I would further request another prominent nurse entrepreneur, inventor, author, TEDx speaker, and first nurse who featured on TED.com. She is a part of inaugural nursing panel feature at SSXW 2018. I welcome Ms. Rebecca Love, who is the first director of Nurse Innovation Entrepreneurship in the United States at Northeastern School of Nursing. She founded the Nurse Hackathon. The movement has led to transformational change in the nursing profession. In early 2019, Ms. Rebecca, along with a group of leading nurses in the world, founded and is president of SONSIL. SONSIL is a society of nurse scientists, innovators, entrepreneurs, and leaders, a non-profit that quickly attained recognition by the United Nations as affiliate member to the United Nations. Rebecca is an experienced nurse entrepreneur, founding HiredNurses.com in 2013, which was acquired in 2018 by Rialto Limited, United Kingdom, where she served as the managing director of US markets until its acquisition in 2019. Currently, Rebecca serves as vice president of customer strategy and engagement, optimizing RX. Rebecca is passionate about empowering nurses and creating communities to help nurses innovate, create, and collaborate to start business and inventions to transform healthcare. I would like to welcome Ms. Rebecca Love for the session.
Thank you, Mr. Haq. This is so nice to be here. I've been blown away by the information. And Dr. Gupta, thank you so much for the presentation that you gave. Today, I'm going to go quickly because I'm going to show you two resources that I think are very important. And I apologize for the screen as the way that it appears. One of the leading resources on the COVID-19 crisis that many people are looking towards is Johns Hopkins, which is the leading platform that basically is tracking and also monitoring COVID-19 outbreaks across the world. As you can see, the United States, Brazil, and India are transforming and basically leading in these areas. COVID-19, as we know, is an unprecedented time of which we're living in. Patients that we are experiencing this kind of level of infection is leading to a completely ununderstood area of where we're going. And just to Dr. Gupta's point, this disease has been very poorly understood because it is relatively new to the global world for the last 6 months. As you see, we have almost 14.5 million people around the world are currently diagnosed. And in the United States alone, we're approaching 140,000 deaths. I also want to share with you a website which Bobby explored, which was basically the CDC. It's otherwise known as the Center for Disease and Information within the United States. Here they'll have a number of resources, and they're sharing the latest up-to-date, basically worldwide associations of what's going on with regards to the outbreak across the world and in the United States. So if you're looking for good case studies, you have access to this. They're printing those global case studies. And the reason actually that I joined this is during the time of COVID-19, we need you as nurses and leading pharmacists to basically adapt and also lead during this time. What we had experienced in the United States was back in March 2000 early March.
Yeah, unfortunately.
No, it's not easy. I know. Well, so I'll share with you guys. Back in early March, the coronavirus broke out, as you guys know, in New York City. Suddenly, around middle of March, on Facebook, on social media, we started to see posts about nurses who had no access to the PPE. Basically, the supplies that they had been presented with were taken and being locked up, and nurses were going on Facebook and asking for masks to be given to them, and they would pick up in their community. Now, at this time, there was no actual news reports on this, and as you know, as a nurse and as a pharmacist, this is highly unusual that you would go into a hospital system and not have access to PPE. And why that was going on is in the United States, people in our country, we were going through PPE. Within the first 3 months of this virus, many of our hospital systems used up their annual budget in 3 months' time to purchase gowns, gloves, and masks in the United States. As an organization, when we started to see these posts by nurses that they were not receiving PPE, we took action and started a program called the SHARE program. And the SHARE program largely was an idea that you could potentially donate PPE and get it to the front lines. In the course of the period of about 6 months' time, we have raised, as you can see nearly here, about $100,000. We've moved 300,000 pieces of PPE across the United States. And more importantly, we've helped about, at this point in time, we had a request of nearly 500 requests for PPE across the United States. And at this point, we've helped over 100 of those systems to basically get access to PPE. So the reason that I'm here to talk to you today is just to leave you with this idea that during times of global crisis, there are opportunities for all of us to move forward and help the world see this crisis and do more things. I often hear from nurses that they explain to themselves and to each other that I'm just a nurse. And the idea of Sanciel, which both Bobby and also Shalati are both founding members of, was it's an opportunity to really redefine what the profession of nursing can do, not only for themselves, but for everyone else. So we took action, we took organization to move that forward. And in addition to just dealing with the SHARE program that we initiated, we also started to host global nurse meetups for 5 weeks during the crisis, in which nurses from around the world would get on a phone call and share what they were experiencing on the front lines. And through that moment and through that time of innovating, we found out some of the best practices. In fact, it was there that we discovered that nurses were proning patients, taking them from what would be considered very counter to what we learned in nursing school, which is high Fowlers if patients have respiratory distress, and actually turning them onto their abdomen so that they could breathe better. There were other situations of learning how to do non-rebreather masks, how to secure those safely, so that maybe perhaps we would not have to intubate a patient, because currently in the United States, patients once intubated have an 86% chance of dying. One thing that I do want to leave you with, which I think is one of the most critical points, it's something for you to think about, is our healthcare professionals in the United States are documented to be contracting COVID at a rate of 12 times higher than the general public. Now, in the United States, we've lost nearly 900 healthcare providers. However, the good news is that we are starting to see that through the use of PPE and actual good coordination of hand sanitization and the uses of donning and doffing PPE correctly are decreasing those numbers effectively. So I'm going to leave you here to say that the world needs you. There's never been a time in which the world is so desperate in need of caregivers. And it is because of you that you're going to change the future. So thank you for joining this profession. I look forward to talking to you more in the future. And thank you for being where you are today to help the world see through the largest crisis we've had in 100 years. So thank you.
Great, Rebecca. Thank you.
Thank you very much. Thank you for such a wonderful detail, and congratulations for all the efforts you made. And I would like to thank you, every speakers here who has helped us out for such a wonderful sessions, and would like to hand over the session to the Principal of Nursing, Professor Pranati Barua, for her final vote of thanks.
Very good morning to all of you, and it was really a great honor and pleasure for us when we could have personalities like you people who have shared your expertise, knowledge and the experience about the COVID-19. I know it is a global situation, so I think we require a global sharing. And so we are here today. I am really here honored to pay my vote of thanks on behalf of MCHSR to all the eminent speakers, Dr. Sonia Lal Gupta ma'am, Ms. Bobby Martin, Ms. Shalati Gupta, Ms. Revika Lal. And I know all of you are very busy and having busy schedule. In spite of that, you were here with us and to discuss about the COVID-19 and its prevention and control. So my sincere thanks and warm, especially the special artist thanks go to all of you. All the sessions were quite interesting and having very latest informations. And I hope everybody of us and others also enjoy. And lastly but not least, I would like to thanks to all the faculty and the people over here who have helped to have these sessions, especially Mr. Jasimul Haq and our director, Kanak ma'am, and also the other peoples, those who helped to organize this thing. So thank you everyone, and I hope in future also again we will have like this sorts of sessions so that it will help us also and help our students also to develop more knowledge, and maybe it will help in their career, in our career also. So please, I welcome also and I say my thanks also. Thank you everyone.
Thank you every single person here, the participants, for participating in such a wonderful session. You have been having very lucky here to listen such a international and eminent speakers. By sitting at home, COVID-19 has made us learn more and more of the things, but especially this, what we have learned, that we can learn every single thing by sitting at home. And this is, we are starting with Kindshell Global. I would like to pay my thanks to Kindshell Global as well for providing us opportunity to associate further. We'll be in future also participating for further programs as we discussed. So from my side also, thank you very much to every single person, especially my speakers. Thank you very much. I would hand over to the Managing Director, Dr. Sonia Gupta, for further vote of thanks.
I just want to thank Shaladi, Rebecca, and Bobby. Amazing sessions and such a pleasure. And we're honored to tie up with you and have this session. And I've trained in the US, so believe me, everyone, when I say you have such esteemed, amazing speakers over here, you should be really, I think it's so wonderful that people, just to students in India, they can understand what nursing and what are the options for nursing. I think what people have to understand is the world is open, always widen your horizons, look ahead, and just looking at such esteemed people from your own field. I think all the students should just get that motivation, look where we can go and what we can become and where we can reach, So the world is just not, yes, I studied here and this is it and this is my life. No, think big, think ahead. And of course, to each and everyone, please stay safe. I really hope, all these valuable tips and the session really helped you understand what is this pandemic, what it's doing to the world, and why it is important that you understand why prevention is necessary. And this is also important not just for you, but for you to now further educate your family. Again, this is a community disease. It is just not about you. It is about everyone. It is about protecting everyone. So please take this message home. Understand what you've learned today. Teach your family members. Teach your neighborhood. Spread this message. And I think, as Mr. Haq rightly said, the only good thing COVID has done, it has brought the world so close. I think the amount of time I've spent with talking to family now, all across the globe, I probably never did in the past all these years. So I think we're really happy and excited to further, have a lot more sessions with Kindshell Global, and I would love to have that international perspective for our students over here to understand the opportunities that they have as well, in other countries, and what all they can do, to grow further. So thank you so much again for taking out your time at, an unearthly hour and to be over here. So really, really appreciate it again. Thank you so much, everyone. And thank you to all the participants for, taking out time to attend this. It is steps like these which help you grow, become a better person, and and help you become a much more knowledgeable person. And so it's wonderful that you took the initiative, and I was very happy to see the attendance that we had. So I'm very happy that everybody's taken so much interest in this. This gives us even more motivation to hold further sessions like this. And special thanks to Dr. Kanak, Mr. Haq, and all our faculty team members who have worked really hard in making sure this event becomes a success. So thank you to each one of you. Thank you so much. Take care. Stay healthy. Stay safe. Bye bye.
Thank you. Bye bye.
Bye.